1%. These statistics are of concern at a time when the popularity of dating apps and sites is growing in Africa. Okay, let's now delve deeper into this issue. For that, I'm joined by Professor Naeemah Abrahams, a specialist consultant with South Africa Medical Research Council's Gender and Health Research Institute. Professor Naeemah, welcome to the program. Let's start by discussing that law that President Ramaphosa signed just before the election last year and its implementation thereafter. The numbers are still worrying. Is it that the law hasn't been given enough time to take effect? What's going on?
Good evening, Wahiga. Thank you for inviting me. So the law that you're referring to is the establishment of a National Council of Gender-Based Violence and Femicide. Since that time, nothing has progressed any further. It has been signed, but we have not seen who will be on the council. We have not seen the role and the responsibilities of the council members, the functions, and so it's extremely slow. And establishing a council to take care of gender-based violence in the country and femicide is but one of many, many things that are required. So it's slow, and we have not seen any progress. We have great laws. We've got the Domestic Violence Act, yeah.
I was actually going to say, and whilst the implementation is slow on one side, the statistics are getting even more troubling. Just give us some of your concerns, what you've noted from some of the data out there.
Yeah, so the statistics on women being killed because they're women, the term we use is femicide, really shows that South Africa has one of the highest rates in the globally. Overall, you refer to the UN report that releases how the number of women killed by their intimate partners or family members is around about, South Africa has 4 times the rate that the UN reports globally. The same reports by the UN shows that in Africa, the largest numbers of actual numbers are reported from Africa overall. We're very fortunate in South Africa that we are able to do dedicated research where we follow the women that are being killed, we followed up the investigation, and we're able to establish who killed the woman if the police did a investigation, if they found a perpetrator, and if a conviction happens. And that is not very often. In Lorato's case, very sadly, she was killed. The police acted very fast. They did find a suspect, but that is not the normal. That's not the norm. About 1/3 of women are killed in our country. A perpetrator is never found.
Because there are those who raise a question about dating sites and these apps, where people are able to connect online as being a factor in the worsening of the situation. What's your data showing?
So unfortunately, this is a new phenomenon. Dating, social media is a completely new ways in which perpetrators are trying to access women and trying to get to vulnerable women. And so we don't have a lot of information. There's anecdotal information about it being used to lure women into situations. And we're also now getting a lot more information about what we call technology-facilitated gender-based violence. And we need more research. We understand the problem better.
In the midst of the problems, very briefly, are there any spots of hope, any interventions that you've seen working, even if it's in certain townships or areas?
Well, the hope is in advocacy for this. There's no way that our government on its own will do anything about the problem. We need communities to stand up, to call and to ask for action, and to make sure, for example, the law we referred to right at the beginning around the council, that these things are being done, that we put money. It's not an easy problem to overcome. It's going to take years. There's no silver bullet, gold bullet to deal with it. So we need to really get a complete societal response to deal with it. We require from health, from the law. The law is not the only thing. The law is but one part of the solving problem.
Professor Naeemah Abrahams, very insightful thoughts there. Thank you so much for joining us on the program. A specialist consultant with South Africa Medical Research Council's Gender and Health Research Unit, joining us on the program.